Bismillahirrahmanirrahim. Today I am going to discuss the fundamentals of determination of axis of the heart. So, we all know there are 12 leads of an ECG, and there are 6 limb leads and 6 precordial leads. Limb leads are 1, 2, 3, AVR, AVL, and AVF. So, to determine the axis of the heart, we use lead 1 and lead AVF. So if I draw a table putting lead 1 here and lead AVF here, we have to look at the direction of QRS complexes of these leads. So a normal will be here, right axis deviation will be drawn here, and left axis deviation will be drawn here. So in case of a normal axis, the direction of QRS complex in lead 1 will be upward. Similarly, it will be upward in lead AVF. In case of right axis deviation, direction of QRS complex will be downwards, and direction of QRS complex in AVF will be upwards. In case of left axis deviation, the direction of QRS complex in lead 1 will be upward, and the direction of QRS complex in lead AVF will be downwards. Now I tell you a mnemonic, and that's my own mnemonic, and it has got nothing to do with the mechanism of formation of axis. If we focus at left axis deviation, or here, we see that these two QRS complexes, like the QRS complex in lead 1 is upward and in AVF it's downwards, so it seems like they are leaving each other, so they have left, so it's left axis deviation, just to remember. And the opposite is definitely right axis deviation. They are facing each other and it seems like they are approaching each other, so it's right axis deviation. Now I give you some examples of the ECGs that will make you understand. This is a 12 lead ECG, and just focus on lead 1. The direction of QRS complex is upwards, and now focus on lead AVF. The direction of QRS complex is downwards, so it's like this: lead 1 here and lead AVF here, so it's left axis deviation. This is another 12 lead ECG, and again focus just on the direction of the QRS complex, although there are other findings of ST elevation and AV blockage as well, but for the time being just forget about it and just focus on the direction of QRS complex. Here we see that lead 1, the QRS complex is upwards, and in lead AVF it's upwards as well, so it's like this. So both are upwards, so it's a normal axis.